Okay, I think we're going to go ahead and get started. Thank you everyone for joining. Welcome to today's webinar hosted by U.S. Senator Bob Casey's office, Pennie, and the Pennsylvania Department of Human Services. I'd like to thank everyone for taking the time today to join us to learn about the end of the Medicaid and CHIP continuous coverage requirement, staying insured, and in what ways Senator Casey's office may be of assistance to constituents. At the end of the presentation, we will allow some time for Q&A. My name is Holan Bakalis. I'm one of the constituent advocates for Senator Casey, and I work out of the Washington, D.C. office. I will be facilitating today's call. Also joining us from Senator Casey's team is Abby LaForme, our constituent advocate who works out of the Senator's Philadelphia office. From Pennie, I'm very excited to introduce our presenters, Executive Director Devin Trolley and the Director of External Affairs, Chachi Angelo. From the Pennsylvania Department of Human Services, I'm also very excited to introduce Acting Secretary Val Arkush and the Bureau of Policy Director Carl Feldman. We're very grateful for their time and willingness to partner with our office to help increase awareness about staying insured through the Medicaid and CHIP unwinding. We know that losing health coverage is a stressful time for folks, and people might not know where to turn to find affordable health coverage. Other constituents may have looked at insurance on Pennie in the past, but perhaps not within the last few years. The Inflation Reduction Act's extension of the enhanced subsidies have made health coverage on Pennie more affordable for more people. And with that, at this time, I would like to turn the call over to our first presenter.
Sure, happy to start. So my apologies, I thought we were going in different order, but I'm happy to kick us off. So today, talking about some changes coming to health coverage for Pennsylvanians in the next year. So this will be a joint presentation from the Department of Human Services to talk specifically about what that means for Medicaid and CHIP, and also from Pennie, which is Pennsylvania's official health insurance marketplace. And for anyone who's not familiar with Pennie, we started in 2021 and took over operation of the health insurance marketplace from healthcare.gov. And what that's allowed us to do is make the health insurance marketplace more tailored to Pennsylvanians, offering more plan options, even lower cost for coverage as referenced before, and better coordination with Medicaid and CHIP. And in this coming year, as there are changes to Medicaid and CHIP coverage, which we'll dive into in just a minute, that coordination will be even more important, and it allows our two programs to make sure that Pennsylvanians have options for themselves to stay covered, to ensure that that critical peace of mind that comes from having coverage is maintained no matter what program or what coverage ends up being appropriate for them long term. So if we go to the next slide, I believe I'll turn it over to Carl or Acting Secretary Arkush to make some comments from DHS and then take us into some of the details about what's coming this year.
Thanks, and I believe Acting Secretary Arkush is available now too.
Hear me now?
Yes.
Thank you.
All right. Good afternoon, everybody. Can you hear me? Carl, can you give me a high sign if you can hear me?
Yes, we can.
Okay, great. Terrific. Apologies for that. Thank you for your patience. I'm Dr. Val Arkush, Acting Secretary for the Pennsylvania Department of Human Services, and I want to thank Senator Casey's office for hosting us today to make sure that Pennsylvanians who receive their health care coverage through the state know about upcoming changes to Pennsylvania's Medicaid and CHIP programs so that you can protect yourselves and your families and make sure that you stay covered. Starting on April the 1st, everyone who gets their health coverage through the state must complete their annual renewal when it is their time to renew. If you don't, you risk losing your coverage. Now, I want to be clear that no one's health coverage is automatically stopping on April the 1st. You will not lose your Medicaid or CHIP coverage without an opportunity to complete a renewal or update your case information over the next year. Renewals go out through the year, and the dates are unique to each person. And you'll hear more about what the renewal process looks like in just a few moments. In the meantime, please make sure that your contact information is up to date with DHS. This is a very simple step that you can take today to make sure that the renewal process goes as smoothly as possible. And it's critically important that when it is your time to renew, you complete your renewal on time so that you can stay covered. Our goal throughout this process is to make sure that Pennsylvanians maintain health coverage, even if they need to switch from Medicaid to another plan. And we're working closely with Pennie, as you just heard. Pennie is Pennsylvania's health insurance marketplace, and we are working together to make sure that every Pennsylvanian stays covered. So even if you think or you know that you no longer qualify for Medicaid, it is still very important that you complete that renewal so that if you don't qualify, we can get you connected to Pennie as quickly and smoothly as possible. This is a big undertaking that can affect individuals' health and the health of our communities, and we need your help. So if you have a friend, a loved one, or a neighbor who receives Medicaid or CHIP, please share this information with them and ask them to be on the lookout for renewal information. You can go to dhs.pa.gov/stay covered for more information on the renewal process and resources to help you spread the word in your community. Health coverage and insurance are essential to our daily health and well-being, and the Shapiro administration is committed to helping Pennsylvanians through this critical period so that we can all stay covered. And now I'd like to turn it over to my colleague, Carl Feldman, who's going to share more about what the renewal process will look like over the next year. Thanks, everybody, and I'll turn over to you, Carl.
Thank you, Secretary. So yes, we're going to start by talking a little bit about the background of what's taking place in the Medicaid system. I think this is probably one of the biggest changes to Medicaid since the passage of the Affordable Care Act. You may know that the federal government has been under a public health emergency designation since 2020. And as a result of that, states have been able to maintain coverage for individuals in the Medicaid system, regardless of their circumstance, throughout that time. This is known as the continuous coverage requirement, and we've maintained coverage for CHIP families as well. Throughout that time, despite the fact that people were maintained in their coverage, we have continued to send renewals to them so that we can continue to collect information on their cases. But if the result of the information we received is that the person would not have otherwise been eligible, we're not taking action to disenroll those people. As a result, you can imagine that the program has grown, and it has. In Pennsylvania, there are over 3.6 million people enrolled in medical assistance in Pennsylvania, and that's about a 28% increase since the beginning of the public health emergency, and that tracks with national trends for the Medicaid system as a whole. Of those individuals, 617,000 have shared information with us, indicating that they do not meet our eligibility criteria, and another 577,000 did not submit a renewal. And so based on that, all we can say is that we don't know what their circumstances are. Now I'm going to talk, next slide, thank you. Now I'm going to talk about what the continuous coverage period ending really means. In the federal budget passed at the end of 2022, the continuous coverage requirement we talked about was separated from the public health emergency, and that will end on April 1st, which means that people who come into the program after April 1st will be processed under normal procedures, and if they're not eligible at a redetermination, they will be disenrolled. Renewals throughout the what we call unwinding of the public health emergency, unwinding of the continuous coverage requirement, will take place over a 12-month period. So not everything is going to happen at once. I think we really want to emphasize that people don't need to be concerned that every single person in the state is going to have an eligibility redetermination in the month of April. It's going to happen over the next 12 months. And also, households that were maintained are not going to immediately lose coverage, even if they shared information with us previously showing that they would not have otherwise been eligible. They're going to have a renewal conducted to determine if their eligibility circumstances have changed. In some cases, we can in fact automatically renew their eligibility based on the information we have available to us. So it's really important to emphasize, as I said, that this is going to take place over the next 12 months. People will need to do their renewal in the month they receive it, and that they will have an opportunity to show whether they are still eligible or not for the program before any negative action is taken. Next slide, please. We want to make sure that you see some of the messages that we're sending to people during this unwinding period. And these come on a 90, 60, 30-day communications time frame. And you can see the outreach that we are doing is multifaceted, it's multi-layered, and we're going to reach people in as many modes as possible. There's, of course, mailings that we must conduct that will include important information, but we're going to accompany those mailings with text messages, phone calls, and emails. And we're not going to do just one of those additional modes. We're going to attempt to do all of those additional modes if we have the information necessary to do it. You can see these communications on our website, which will display everything that is in fact said to Medicaid recipients. So if you have any concerns about whether the messages being sent to you are legitimate, you can make sure to confirm that on our website. Next slide, please. Here's the key messages that will be included at that 90, 60, and 30-day interval. At 90 days, we really want to make sure that people know that they need to check and update their contact information. That way that we can get this correspondence to the right place at the right time. At 60 days, we're going to send information about the upcoming renewal, and it encourages completion of that renewal over Compass, but also shares information about our other modes of renewal completion. It's going to include a frequently asked questions document about the end of continuous coverage and everything necessary to complete a renewal over our public benefits online portal, Compass. And finally, at 30 days, the message is going to be that now is the time to complete the renewal. People will receive their renewal in the mail at that time. And if they have not already completed it on Compass or over the phone, we want them to do that as soon as possible and return it to us. Next slide, please. Once the renewal is due, we're going to take the information provided and process that. The end result of that may be that eligibility continues, which is certainly a good outcome. It may also be that someone is no longer eligible for medical assistance coverage. But as the Secretary said, we want to ensure that people are covered no matter what. And with the information available to us, we're going to evaluate coverage for Pennie on the state-based marketplace, and we're going to evaluate coverage for CHIP too. That's why it's so important that everyone returns their renewal regardless of whether they believe they're eligible or not. Having that information is key to making the best warm handoff possible. And we're going to try to reach people even if they don't return that information by working with Pennie. I'm now going to hand it off to my colleague, Chachi, and he's going to talk about Pennie's efforts.
Wait, don't go anywhere, Carl. You got to check and make sure my sound is working.
You sound good.
Okay, great. I was a little gun shy there. Thanks again for joining us this afternoon. My name is Chachi. I'm the Director of External Affairs with Pennie. And in this process, I'm really glad that Carl mentioned that we want to quell any fears that, that, you know, come April 1st, that not everyone is going to, lose coverage immediately. It's going to be on an ongoing basis. And if we could just jump to the next slide, I want to say that, as the state-based marketplace, we're here to really make sure that folks in Pennsylvania get the coverage that works for them. If they are no longer eligible for medical assistance, they can, there's going to be a nice warm handoff over to Pennie, but if and only if you respond with your renewal packet. So we'll take two different tracks here. One is if somebody responds to DHS's materials and is deemed ineligible for Medicaid, their information will be securely and automatically transferred over to Pennie and basically given a jump start, a head start in the enrollment process. So Pennie will mail and or email an official notice with an account code to claim your Pennie account. We'll give you an estimate of your financial savings, also known as tax credits or immediate tax credits that you can take advantage of to help lower the cost of your coverage and care, and then also your enrollment deadline. So we highly encourage you to enroll within 60 days of your end date of medical assistance so that there is no gap in coverage. So really all that you have to do is that information that gets sent over to Pennie from DHS will be enough of information for us to put you right at the end of the game, which is choosing a plan and staying covered. So we will be performing outreach with follow-up emails and outbound calls so that these individuals in this first track that respond and are deemed ineligible know that they have a safe place to land at Pennie. The second track is those that do not reply with their renewal packet. That information will also be sent over to Pennie, but since we don't have all of the financial information and contact information, we're not going to be able to create an account on their behalf or understand or at least have an estimate of financial savings. So this is, as if the first one's a warm handoff, this one is a little bit of a cold handoff. So DHS will be securely sharing that information as well, to which Pennie will perform outreach with a co-branded postal letter and emails and outbound calls to let folks know that if they have lost their Medicaid, that they can find affordable and quality coverage through Pennie. So if we jump to the next slide, we can talk about some efforts that Pennie put forth to help folks that are potentially losing MA coverage. And the first was creating an extended 120-day special enrollment period for those that for loss of Medicaid and medical assistance, or CHIP. And this really allows more time to enroll, but we really want to highlight the bolded bullet point here that customers are highly encouraged to enroll within the first 60 days so that there is no gap in coverage. And knowing that your coverage from MA can seamlessly go right into Pennie coverage, and that you'll be able to access the care and the health needs that you have. Submitting doing that little jump start that I talked about, that little head start, allows customers to be able to see their financial savings and then go right into plan shopping. And our plan shopping, we really try to make it simple, and we really try to make it so and intuitive so that you can filter based on your needs. And the one major thing that we want to relay too is that Pennie has a no wrong door policy, which means that we work with medical assistance and CHIP. So whatever coverage that you are eligible for, we'll make sure that you get there. So if you come through Pennie's front door, you're eligible for MA, you'll make your way over there into CHIP, and vice versa. So there is no wrong door. Wherever you go, we'll make sure that you get the right coverage for you. And we'll jump to the next slide. Really just a reiteration that Pennie is here to help, can be that safety net for folks that are losing MA coverage, available by phone, virtual, in person. We have Pennie certified pros ready to help you both assisters and brokers. These are friends, these are neighbors that are in your community that are trained to assist Pennsylvanians within the Pennie platform. And then our customer service team is always ready for you at the phone number listed there. And a quick way to get access to an assister or a broker in your neighborhood, pennie.com/connect. And if you're a do-it-yourselfer, we have plenty of FAQs, video tutorials, and more that you can kind of get up to speed very quickly on what it means to access coverage through the Pennsylvania marketplace. And I'll pass it over to our new executive director, Devin Charlie, for some final remarks.
Great, thanks, Chachi. So as you heard here, Pennsylvanians have options to stay covered through Medicaid CHIP and Pennie, and these programs are working together with more coordination than ever before. Health coverage provides peace of mind, financial security, and access to comprehensive medical services. So we really encourage anyone who's either on Medicaid or knows someone who's on Medicaid to make sure you look out for the renewal packets that were talked about here to make sure that as many people as possible can stay covered over the next year. Thank you everyone for joining us today, and especially to Senator Casey's office for hosting this webinar on such an important topic. And with that, I think there may be time for a question or two.
And some information about the materials available to people that are going to be assisting individuals to remain enrolled. So you can find all of this on our website through our communications toolkit. You'll see there materials that include social media graphics, FAQs, flyers you can print, scripts for phone calls, and we encourage you to go on our website and take that information and share it with the people that you work with. Next slide. Next slide. Pennsylvania is going to be doing its part in that outreach, not just through normal channels, but also through paid media, of course, earned media, and community efforts that will be present in people's neighborhoods. So get ready to hear a whole lot more about this, and we hope it's an effective measure to help make sure that people remain covered. Next slide. Here are some key messages we're hoping that can be relayed to people. Signing up for a My Compass account can be done on the Compass portal. That's how people can actively manage their benefits on the desktop. Getting the My Compass mobile app is available through the App Store to do the same. You can sign up to receive text messages and emails through Compass. We want to make sure that everyone's updating their contact information so that we can continue to get a hold of everyone who needs to have a renewal conducted, and these are all the means by which you can do that. And we want to make sure that people do their renewal when they receive it. It can be done through Compass, it can be done over the phone, and it can be done in person. Next slide. The last thing we want to share is that we have a couple additional ways that people can be engaged in this process. Whether you're a provider, a community organization that provides hands-on assistance for benefits enrollment, or just someone who engages with people who are enrolled in medical assistance, you should sign up for our helper portal on the website. That will send you direct information about what's going on during the unwinding. Our Compass Community Partner Portal is available for people who do hands-on assistance for people enrolling in medical assistance and other benefits. And if you're a health provider, you should engage with your medical assistance managed care plans to talk about the work that they are doing together to keep people enrolled in coverage. Next slide. Thank you for joining us, and I do think now is the time that we would take some questions.
Thank you so much for sharing that important information on the unwinding. Before we move into questions, we'll just quickly, I'll turn this call over to my colleague Abby to provide an overview on how Senator Casey's office may be of assistance to constituents regarding healthcare issues and navigating federal agencies.
Thanks so much, Halan. Yeah, like Halan said, my name is Abby Laforme. I work as a constituent advocate in Senator Casey's Philadelphia office, and I'll be quickly presenting some information about how our office could be assistance to you throughout this process. Next slide. So, any inquiries related to healthcare and the health insurance marketplace would go through our constituent services team. Constituent services encompasses the day-to-day bread and butter work of our office, which is directly assisting members of the public with any issues they should have with a federal government agency. Next slide. This is just a visual of some of the agencies that our office corresponds with on a daily basis. As you can see, CMS, Centers for Medicare and Medicaid Services, is on there, as well as other insurance companies like UPMC, for example. Next slide. So how would you go about bringing your issue to our office? There are a number of ways to do that. Primarily, you can leave us a remark through our website. That's www.casey.senate.gov. There's a specific page on our website where you can input any casework related inquiries, and you can leave your phone number and your email and your name with us. And then one of our constituent advocates can get back to you. You can also call any of our offices. Senator Casey has offices across the Commonwealth and also an office in DC. So here's the number for our Harrisburg office. It's 717-231-7540. There's an option when you call to have a casework related inquiry, and that would connect you directly with one of our constituent advocates. Our constituent advocates make up a team of about 10 members at any given time, and the majority of them do work out of Harrisburg. But like I said, I work out of the Philadelphia office, so any of us would be able to help you with an issue. If you don't get connected with someone right away when you call our office, just make sure to leave a voicemail and leave your name and number, and we will always get back to you. Our office checks our voicemails religiously, so it might take us a couple days, but we always do get back to constituents when they contact us. We're aware that a lot of people across the Commonwealth don't have reliable internet access or don't have a computer, so we also do accept letters. You can send a letter to our Harrisburg office, the address of which is on the slide. Next slide. So let's say you bring a problem, whether or not it's related to health insurance, to our office, any issue that's regarding a federal agency. Here is the process for how we deal with that. So we will first connect with you and learn a little bit more about your issue. We would assign it to one of our constituent advocates who works in your issue area. So for example, I work on healthcare issues. That's part of my cluster of services that I provide as a constituent advocate. So it's likely that if you were to call the office with a healthcare related issue and it's something that we can make an inquiry about, that you'd be connected to me. I would have you fill out a privacy release form. It's our office's standard 2-page document. It gives us the authorization to reach out to a government agency on your behalf. So we would deliver that form to you, you would fill it out, sign it, return it to us, and then we would take that form and make a congressional formal inquiry with whichever federal agency your problem is regarding. We do give agencies 30 days, typically 30 days to receive, review, and respond to our requests. So that doesn't guarantee that your matter would be fully resolved within 30 days, but that does guarantee that if an agency does not respond to us in that time frame, that we would follow up with them. Like I said, we can't guarantee that your issue would be fully solved, but we can communicate and advocate for your needs to the agency. And that pretty much sums it up for me. So thanks, Halan, and thanks, Pennie and DHS.
Thank you so much, Abby. At this point, we will now open this portion of the presentation for questions for the Department of Human Services, Pennie, and Senator Casey's office. If you have a question, you may click the raise hand button at the bottom of the participants list to indicate that you have a question. Abby or I will call upon participants that have questions one by one and unmute them. We also please ask that you keep your questions general since this is a public call.
I'll just give a few moments for some raised hands to come in case people have any questions.
Today's presentation, we are especially thankful for our presenters with Pennie and DHS for joining us today to provide such helpful information about the Medicaid and CHIP unwinding and staying insured through Pennie. Please feel free to reach out if anyone has any questions after this presentation, but I hope everyone has a great rest of your day. Thank you.